All right, feel free to give it a spin.
All right, let's see. What do I have? I didn't do so well. What are my thoughts on doctors who claim birth control is necessary in healthcare? I think that's a great question. I think we have to ask ourselves, what is the purpose of birth control? Hormonal birth control works to shut down a normally functioning system, the reproductive health system. So in that sense, it's not necessary for healthcare. Oftentimes, hormonal birth control is prescribed to treat a wide range of conditions, everything from irregular cycles to painful periods to acne. And the reality is it doesn't treat these conditions, but it simply suppresses the symptoms. What we need to do as doctors is to make the diagnosis. Charting the female cycle can serve as a fifth vital sign to aid in addressing and identifying that underlying cause. So, for example, in a woman who has long, irregular cycles, if she has very dry cycles, it's more likely the cause of her irregular cycles is functional hypothalamic amenorrhea, which we would treat differently than polycystic ovarian syndrome, and that may manifest in a woman who has lots of mucus patches on her chart. Either way, the birth control pill may make it look like she has a regular cycle, but it's not treating the underlying cause. So I would respectfully disagree with my colleagues that birth control is ever necessary for healthcare. Basic healthcare does not involve shutting down a normally functioning bodily system. So was I ever on birth control? That is a great question. Yes, when I was in college, I had suffered from painful periods resulting in me not doing so well on one of my biochemistry exams. Knowing I wanted to be a doctor, I realized I couldn't deal with these painful periods month after month. So I went to the student health center to inquire to my options, and I was told, well, the best option was birth control. And I thought to myself, really? I mean, yes, I have debilitatingly painful periods, but it's only 2 to 3 days a month. So I need to take hormonal birth control every day out of the month to treat the symptoms. And I was told, yes, that is the best option. Not knowing any better at the time, I followed the doctor's advice and took hormonal birth control only to suffer from side effects, mood changes, as well as hair loss, which at 21, developing a bald spot the size of a baseball was somewhat traumatic. I realized that was not an option that I wanted to pursue. So I called the student health center like, oh, hair loss, that's a normal side effect. I said, no, this is not normal. And their recommendation was to seek care from a dermatologist to receive injections. And I thought, there has to be something better. So I stopped taking the hormonal birth control pill and years later learned that I could manage my painful periods by being able to chart my cycle and identify when my periods were starting to take preventative measures to minimize the pain that I was experiencing. How would you change sex ed? That is a fantastic question. So as a family physician, I care for patients. Some would say from cradle to grave or from womb to tomb. I like to say I care for patients from lust to dust before people even become pregnant. But when I'm caring for young children, I begin talking to them about their bodies and the way their bodies are designed to function. I would change sex ed by focusing on the way the human body is designed, the differences between the male and the female person. I would talk with them about the changes that they can expect, whether it's erections in young boys or nighttime ejaculations or breast bud development in young girls and the development of pubic hair, and talk about why these changes happen. The other thing I think is critically important, especially with our young girls, is to teach them the way their cycle works. In fact, we have a presentation called Know Your Body, where we teach young girls between the ages of 10 and 15 and their moms to know their body, to understand what is their red flow, which is their menstrual bleed, and their white flow, which is the cervical fluid secretions, which are a result of the normal cyclical hormonal changes. I think if we could focus sex ed by educating people the way their bodies are designed to function, young children may not reject their beautiful bodies and instead learn to work with them and accept the way their bodies are designed. This will truly empower them. I would also remind them the purpose of sex. Sex has two primary purposes: bonding and babies. It brings together a male and a female, and together through that union, they can create a baby. It's important that people understand this purpose because they will then revere that decision more carefully and not simply pursue sexual relations with someone that may not be a partner they want to spend their life with. So Again, being honest and upfront and explaining the beautiful way our bodies are designed and the purpose of the sexual relationship, I think, is critically important.
Hey friends, if you enjoyed this and want to hear the rest of this bonus episode, join us over at rosereport.supercast.com. There you can join our growing community of subscribers for the show and help support our mission to bring the good, the true, the beautiful into the media space.